Okay, so the sort of introduction to this is don't run and hide from the episode on attention deficit disorder in adults. And that illuminates this concept of HIDE, which you're going to tell us about
exactly.
when it comes to. Okay, well, let's head to the word of the day. What is it?
Still.
Still?
Absolutely.
Let us know.
Sir Frederick Still came up with the idea of ADHD in 1902.
Okay.
And since then, and he described something that was not still, but in moving around more so than the average kid did.
Wow. And that's 90 years before I encountered this.
Yes.
And at that time, we didn't think it was really something.
Yeah.
So how did he do this? Like what?
Well,
where did he come up with this?
He was observing children, and one of the interesting things is that children with ADHD are moving around so that it's irritating. If you
to
look
others?
Yeah, to others.
Okay.
Like
all right.
Parents,
okay.
other adults,
okay.
and teachers.
Yeah.
And children that don't have ADHD, they move around just as much, but it's not irritating.
Oh, so there's a difference in the way these kids essentially move.
Yes, exactly.
And he saw this.
And he observed this. That was the old way of doing research, which is you observe something and then start talking to your colleagues about it or your patients about it.
Okay. So these kids are definitely not still.
Yes. Yeah. Well, they're we've talked about the, don't run and hide from making the diagnosis of ADHD because ADHD's key elements, which we use to diagnose people with ADHD, and clearly we make mistakes from time to time, but it's for hyperactivity, and I have ADHD, so I remember having to sit in a desk and when I was quite young and looking out the window, and I'd see some young person riding a bike, and I would think, what is he doing right? And what am I doing wrong?
Because you're stuck.
Because I'm stuck in the desk. I mean, it was just like, and it was, so anyways, so then I is impulsive.
Okay.
And that's essentially, you make quick decisions, and the quick decisions are the opposite of not making a decision. So many people have success with making decisions based on them taking information in, but in terms of managing money, that's something where you can have a problem.
Okay.
And then D is the distractibility, which is the essence of the problem, but it's probably no greater than excitability, or E, because excitability drags you into wanting to learn everything, I remember years ago I agreed, because I found it very interesting to be asked to speak to these two groups, and because I had no ability to plan or organize, they were booked for the same night.
Oh.
Which I realized a couple of days before I did it.
Yeah.
And actually, something my wife has pointed out is that the reason that often people who have ADHD perform very well is because they are experts at solving problems because they're always causing.
They're caught in problems and they're always...
Yeah, exactly. They're causing. I was the one who agreed
Right.
to give a lecture on the
Right.
same evening.
Yeah.
Thankfully in the same city.
So how, because you've been successful, and I think sort of people like myself who are suspicious of ADHD, not
Yes.
anymore, but
Yeah.
used to be, would say, well, yeah, but these people that I'm seeing who've been labeled this, maybe given medication, are still very successful individuals.
Yes.
So they might be more excitable than the average bear.
Exactly.
Or make silly mistakes like double
Yes.
bookings, but
Yeah.
you wouldn't treat them with a drug for that.
No, and I started taking my medication when I was 58 years
So
old.
this is very interesting because, again, like me,
Yeah.
we wait, we don't...
Forever.
Yeah, right. We have no insight.
Yes.
No Bodhi.
Exactly.
Right? And so that means that you went many, many years in your career surrounded by experts in ADHD.
Yeah.
Because
And diagnosing ADHD.
ADHD,
Yeah,
right.
yeah.
But not seeing it
Aware.
yourself. Okay, so what I'm interested in is what was that watershed moment where you went, oh, I got to deal with this. This ain't working for me. Was it an event? Was it cumulative? What pushed you to go, I got to do something? Because you ended up being on medication.
Yeah,
so you
exactly.
obviously did
Yeah, no,
something about it.
exactly.
But what took you there? What pushed you to that point?
Well, it was moving and dragging my family from.
Oh, you actually made decisions like that.
Oh, yes.
Based on
this. Yes.
So
yes,
which
very
of the
well.
hide made you
Well,
do that?
it was the impulsivity.
Okay.
Okay. And also the excitability. So I had visited my brother in San Diego.
Okay.
And so I woke up one morning and he said, geez, what will we do today? We can go golfing, we can go skiing, we can play tennis, we can go to the beach. And after breakfast, I called my wife and said, we're moving to
Just
to
like
California.
that?
Yes, absolutely.
Man.
Yeah, but it was a great experience. So it was always punctuated by, it made something good.
This is going to be good.
This is going to be good. And then I became a bit less stuck in my thoughts, and I was able to not only take in, I could always take patients into consideration.
Yeah.
But then I realized that it was affecting my family.
So that's the key.
Yeah, absolutely.
That was sort of that thing that motivated you to either acknowledge the behavior or change the behavior.
Exactly.
So, that's fundamental when something affects your family and you have the insight to respond to it. But, so that's impulsivity and excitability?
Excitability because you want to learn. You just, when I joined this clinic, I knew that it was a different model, and it also had elements that I'd been thinking about for years and experienced, in smaller
places.
parts. Yeah, and so that's what dragged me, and yeah. So
what about the hyperactivity then? Examples of. Were you truly hyperactive? Or?
Well, I was really hyperactive as a kid, and I think that there's an idea that once you hit the age of 12, and females are different in that they're less hyperactive, but they might be more restless in their chair than jumping up and running around the room. But I think the hyperactivity is really, if somebody has moved to many different hospitals, cities, that's a form of hyperactivity. It's impulsivity,
right,
and it's excitability, and the distractibility is where you finally have the insight, this is hurting my family. When I moved to Vancouver a number of years ago, and I'd sworn up and down that I wouldn't move again.
Right.
But for reasons I thought were good reasons, I decided to move there. My family, at least my wife and my youngest son, my wife said, well, you can go there for a year, and if you find, and if you don't like it, you can just come back.
She had sort of seen this pattern.
Yes.
Figured a way to adapt to it.
Yes.
But that's like huge in a family.
Yes, exactly.
It's a huge adaptation. So then these are negative aspects of HIDE.
Yes, yeah.
What are the positive, because there is the upside, and we're talking about,
well, yeah,
the upside.
The positive is that you're going to make a decision faster than the average person.
Okay.
Many of those decisions will be good.
So they will be good decisions.
They'll be very good decisions.
Because these are smart people.
Exactly. They're often in leadership positions.
Roles, right.
Yeah, because, in the past, long before schools were here, you would want to be led by someone who noticed everything.
Right.
They noticed the poisonous berries. They noticed the snake in the grass. They noticed hearing for the animal you were chasing, and keeping an eye on the weather to make sure it'll all work out.
So they were hypersensitive to the environment around.
Noticing everything.
Everything.
Yeah, they noticed everything.
And they could process faster to make decisions and move things forward.
Exactly.
Okay.
And so...
What's an upside of distractibility?
I think in my practice working with my patients, I think of it as I notice everything, and I need to notice everything while I'm able to listen closely to what someone is saying, and being open to, people will say to me, I feel really depressed, and I'll, ask, what do you mean by that? Because, and yet I think often enough,
rather than just accepting the term depression and moving on.
Exactly.
You want more detail.
Exactly.
Does that change your clinical assessment and how you might treat them?
Yes, exactly.
Okay.
Yes.
So it's a more in-depth, the distractibility is not really a negative thing.
Not at all.
Because it's a negative connotation, right? Talked about your organic experience with
this. Yep.
What changes with medication then?
Well, I'll tell you what really changes is that your mind slows down enough to probably a greater speed than the average person, but
slower than normal for you.
But slower than normal for you, and you can become more aware of, oh, geez, I do that too, and I do that, and so then a big part of treatment is the behavioral patterns, the habits that also need to be attended to.
That you wouldn't really be aware of.
I wouldn't even be aware of. I'm just too busy.
You're living life.
Yeah, exactly. So
this is super interesting because I remember, again, going way back to, when I started out and this became a thing, it was being treated with stimulants.
Yes.
For me to understand, what does the stimulant do to make it better for you?
Yeah, I'll tell you it, and it's why you can give a stimulant at bedtime.
Oh, you stole my thunder.
Oh, okay. I apologize.
No, carry on.
No, I think it's important to talk about sleep because, again, if you can't sleep, whatever else you're struggling with is not going to be
You're moving
dealt with.
off the topic here. This is important. What do the drugs do and you were going to give a good example, but
Okay, I'll give you a better example.
No, give me an example where the drug as a stimulant, traditional stimulant, is actually helping this person focus.
Well, that's right, and that's why there's some experts in the field who say they're not really a stimulant,
Right.
apart from they stimulate your capacity to concentrate, and by doing that, it is slowing down how fast
You
the
process.
thoughts are. Yes.
Yeah.
Exactly.
And this leads to the whole sleep thing, because it's always, we're seeing mums, dads bringing in children. Is my kid's sleep problem because they're on a stimulant? Excuse me, for ADHD, and the fact is it's actually rare.
Yes.
That the stimulants cause a sleep disturbance, and people don't know that.
Yes.
More importantly, what you were going to say is that it slows the thinking at bedtime and allows some of these individuals to actually sleep.
Absolutely. Even though every medication that is used for ADHD, they describe how it can cause insomnia. I'll often say to the patient, this is something that perplexes me, because if you can concentrate, then you can be in the here and now and not be anxious about all the different concerns you have, and or your mind is just racing through all the different topics of the day that you've been exploring. And so if you can be in the here and now, then you could do breathing exercises that would allow you to go to sleep.
And you open the door to the sleep state. This is the way we
Yes.
describe it, the gate, as it were. And it's really interesting because there are two ways we look at this. One is there's a state of anxiety that is exacerbated at the evening as the person gets closer to bedtime.
Yes.
And we use certain drugs to just dampen down the evening anxiety.
Yes.
And then people are okay. Alternatively, in ADHD, it's not uncommon to trial the medication at night.
Absolutely.
In an attempt to slow the thinking
Yes.
and get them to sleep. So I think it's really important to actually clarify that, even for our colleagues.
Yes.
Because many docs don't actually know that this is the case. And
Yes.
it took
Yes.
me a long time to learn this. So how did it feel to be treated?
It was illuminating. I to some extent I had tears in my eyes because I felt less anxious because I wasn't trying to juggle so many things. I just felt much more in the here and now.
So this is important because you raised the issue of anxiety.
Yes.
And I think, I want to understand, where does anxiety come into ADHD? Because you always say this on rounds, we're talking about a patient or whatever, but can you explain to me more of the detail of the interaction between anxiety and...
Yes, it's an important, I think it's an important point from the experts who have been arguing for years. You can have anxiety with ADHD, and then they would falsely attribute it to the medications that the person was
for
taking.
the ADHD.
Yes, yes, and so you got to be careful with ADHD medications because they're stimulants, so it's going to make the person anxious, and what we know is the medications diminish anxiety. That is very clear. There is abundant scientific evidence. Of course, not for everyone, but in the majority, it's surprising.
And in your case, you would say the anxiety is generated out of the symptoms that drive a pace.
Yes.
That sooner or later you just can't keep up with?
Exactly.
It's just too much going on.
Exactly. I mean, when I lived in San Diego, we lived in 4 different homes over 3 years.
Yeah.
And it's because, we would see something, I would see something more interesting,
Just go.
and we would move. I mean, there's always, if you're renting, you're under some pressure, but I think that in my first 10 years, I owned, I think it was 5 or 6 houses, which can interfere.
I was going to say,
with money.
Your wife needs a medal.
Oh, there is no question. There is.
I had no
no
idea.
question about that. But other doctors will like to work with me because they'll know this guy. I'm experienced. I have worked in a number of settings, and been. I mean, I've always been so interested in patients because I'm hearing a news story, and you're that you can do your best to contribute to a good outcome.
Yeah, there's another level of evaluation of a patient from you that's a whole other level. Because the depth of it definitely goes beyond the traditional psychiatrist, where you just get an answer.
Yes.
And so it's that's very so it truly makes you better at what you do.
Yes, it does.
What about a surgeon?
I think that if a surgeon who is operating, they're going to notice every possible, because one of the things I remember in surgery is you open up someone's abdomen, do any kind of surgery, and there are so many variables, or some blood vessel is bleeding, and it's like
they're just aware,
and they just know. They can see everything, they can address everything, they can prioritize.
Is a person occasionally, are people with ADHD hyperfocused?
Yes, they are, and it actually, it can be, and I think it's important because it's happened. Well, I guess it's more important if it happens to me, but for many other people, you can hyper-focus so that you spend too much time with writing a report, or so it's sort of like the paperwork has to be addressed, and you want to do your best to include everything that you believe is important, but
not necessary.
It is not absolutely necessary.
It's not efficient. So in the end, with the medications, you've said the benefit, which is super clear, it helps you focus and whatnot. What are some of the downsides that you see clinically when you're treating patients from a behavioral perspective?
Well, one big issue is where patients have become informed about it can cause insomnia.
Right.
And so it's I'll explain to them every single medication that is listed with this class, they say it causes insomnia. And my assumption is that the people who wrote that didn't have ADHD and had never taken one of these medications. The other is it lowers appetite, and that is appealing to lots of people, but when you're younger, it can affect, it can affect growth. Exactly, and so that is monitored. But all you have to do is ask the person. I mean, I would usually be the first person to finish dinner because I was always in a hurry
to go somewhere.
And wouldn't even notice did I eat too much or didn't I?
Okay.
Now I'm the slowest eater because I'm more conscious of trying to not be in a hurry, and also I just don't have that kind of appetite.
Right. But what behaviorally might you see? And cognitively, the downsides of the drug, agitation, I mean.
I mean, it could. It could be, but again, it.
No, I'm asking from your
Yeah,
experience.
I don't understand how it agitates people.
Then you don't see it.
Oh, I see it.
Okay.
And I think that that is a real phenomena, but it's something that is much less common. But also people are concerned about taking the medication. And that has to be respected so that we have people that are ADHD coaches or people that do therapy and help deal with these behavioral patterns, and that can be enough.
Right.
And that's an appeal. There's nutritional factors. When I was studying during medical school, I always would drink, coffee, many cups of coffee while studying, not realizing that I was trying to focus.
Right.
Tell me about some of the sleep issues.
Yeah. So we see these people all the time, right? And so they may not be coming to us with sleep issues related to ADHD. It might be just this, I have ADHD, but I have insomnia and I can't fall asleep. So it's really important to do a proper sleep evaluation because there can be an overlap where they're not connected. So the sleep problem is not related to the ADHD. The classic example would be the teen, so let's say 13 to 18, who has delayed sleep phase. In other words, they're a night owl, which is super common and not uncommon for them to have the comorbid diagnosis or co-diagnosis of ADHD. And so the sleep difficulty is completely separate. It's treated separately. It's not made worse by the stimulant that they're on for their ADHD. And when you treat the sleep problem, as you always say, you improve the overall quality of life.
Absolutely.
So that would be a typical example. We rarely see people whose insomnia is due to the stimulant they're on. That's very rare.
Yeah.
But it's very common for the parent or the individual to come in and go, could this drug be causing my kid's sleep problem, or is the drug causing it?
Yes.
I mean, the simple question is to go pre-post drug, did your sleep change? And usually no.
Yes.
They had the insomnia long before they were treated and it didn't change. So it's rare. If they're taking the stimulant later in the day, which may be the case, I think it's pretty rare, definitely it can be a problem.
Yeah, I see. Well, in terms, like you were saying years ago, you said, well, you were a sleep expert and you thought, well, how can this, how do you diagnose ADHD in somebody that's not sleeping? And my thoughts are that when we approach a patient as a psychiatrist, we need to be thinking first about, is there a physical problem?
Yeah.
And sleep is a physical problem.
This is really important too, and I think we can sort of wrap it up here, is that, you can do a sleep history, see there's a problem, but what you've educated me about is you can still ask a good history about ADHD symptoms and separate those two out. I believe.
Yes,
as a physician doing a history, you can go, there's ADHD, in spite of the fact that they have a sleep problem.
Absolutely.
This person's history is quite clear that they probably have that. And that's a huge deal for me. I mean, I've learned a lot.
Yeah.
I have to thank you. So my last question it comes from an example, a patient, and if you find out late in life, a doctor says, I think you might have ADHD, and you're questioning whether it needs to be treated because your life isn't disrupted, like what would you say to that? You chose to be treated. You had reasons, you were motivated. This person's saying, I have sleep problems, I just want that fixed. And should I be distracted by this ADHD stuff? Yeah,
exactly. Well, I think that if the person is having a problem with sleep, it is possible that it's related to ADHD. And if somebody has made that a doctor's made that diagnosis, it's something to take into consideration. But if the person is reluctant to take medication, that I think would be assessed by addressing the sleep disturbance
And
first.
see if things...
And exactly, exactly. And there are other treatments than
Stimulants.
Yeah, exactly.
Behavioral approaches and whatnot.
Exactly.
And I mean, we do this as well in,
Exactly.
anxiety versus insomnia, depression.
Exactly.
Insomnia, sometimes you treat the insomnia and the mood improves.
Exactly.
And so it's a similar thing. So that's very helpful. Okay, well, let's get on with homework. Do you have homework for people?
The homework is to look up online CADRA, and that stands for the Canadian ADD, Attention Deficit Disorder, Resource Alliance.ca, and you can reach out to them for a questionnaire, and you can reach out to them for the different resources that are available.
Cool. And to me, I would say that people, the homework would be for people to just question, after all we've said today, do you think you fit that mold that Chris has described for ADHD? And test out your distractibility and do multiple things at once and just ask yourself, how do I feel right now? Do I feel anxious? Do I feel somewhat overwhelmed? And it might be the way that you figure out, oh my goodness, I might have this. And then go see your doctor or your primary care provider.
Yep.
Okay, so no hiding from adult ADHD, only running. So if you think you might have it, and get your head to bed.
Get your head to bed.
Good. Well.